thrush is a common fungal infection in babies. It appears as white patches in the mouth, especially on the tongue, inner cheeks, and roof of the mouth. While it might look a little alarming, it's usually harmless and easily treatable. Thrush is caused by an overgrowth of Candida albicans, a type of yeast. This yeast is naturally present in our bodies, but sometimes it can multiply rapidly and lead to an infection. Don't worry too much if your baby develops oral thrush. It's a common occurrence, especially in newborns and infants. With proper treatment and care, you can easily manage this condition and ensure your little one's happy and healthy smile. Babies have developing immune systems, making them more susceptible to infections like oral thrush. Several factors can contribute to the overgrowth of Candida albicans in their mouths. One common cause is the recent use of antibiotics. While antibiotics are effective in fighting bacterial infections, they can also disrupt the natural balance of microorganisms in the mouth, allowing yeast to thrive. Another contributing factor is a weakened immune system. Babies born prematurely or with certain medical conditions may have weaker immune responses, making them more prone to thrush. Furthermore, warm and moist environments favor yeast growth. This is why babies who use pacifiers or frequently bottle feed are at a higher risk of developing oral thrush. Recognizing the symptoms of oral thrush is crucial for prompt treatment. Early detection can help in managing the condition effectively and prevent further complications. The most noticeable symptom is the appearance of white patches in the baby's mouth. These patches are often mistaken for milk residue, but they do not wipe away easily. These patches, often resembling cottage cheese, can be found on the tongue, inner cheeks, roof of the mouth, and even the gums. They can vary in size and may sometimes merge to form larger patches. In some cases, the patches may be slightly raised or have a yellowish tinge. This discoloration can be a sign of a more severe infection that needs immediate attention. The affected areas might also be sensitive or painful, leading to fussiness, difficulty feeding, and even crying during nursing or bottle feeding. This discomfort can cause the baby to refuse feeding, which may lead to weight loss or dehydration. If you try to wipe off the white patches, you'll likely notice redness or slight bleeding underneath. This indicates that the infection has caused irritation and inflammation of the delicate tissues in the mouth. In severe cases, the infection can spread to the back of the throat, causing discomfort and difficulty swallowing. This can make it hard for the baby to eat or drink, further complicating their health. If you observe these symptoms, it is important to consult a healthcare professional promptly for appropriate treatment. If you suspect your baby has oral thrush, it can be a worrying time for any parent. It can make feeding difficult for your baby. It's essential to consult your pediatrician for proper diagnosis and treatment. Your pediatrician is trained to identify the symptoms of oral thrush and can provide the best course of action to treat it effectively. The doctor will examine your baby's mouth thoroughly and may recommend an antifungal medication, typically in the form of an oral gel or liquid. This medication helps to eliminate the fungus and relieve the symptoms. These medications usually contain nystatin or fluconazole, which are effective in killing the Candida albicans fungus. Nystatin is often preferred for infants due to its safety profile, while fluconazole may be used in more severe cases. It's crucial to follow the doctor's instructions carefully and complete the full course of medication, even if the symptoms seem to improve earlier. Stopping the medication too soon can result in the infection returning. In addition to antifungal medications, the doctor might also recommend measures to alleviate discomfort and prevent the infection from spreading. These measures can help soothe your baby and ensure a quicker recovery. This may include using a soft, clean cloth to gently clean the baby's mouth or applying a prescribed antifungal cream to the affected areas. Remember, your pediatrician is there to support you and your baby through this process. Don't hesitate to reach out with any concerns or questions you may have. Regular follow-up appointments may be necessary to ensure the infection is fully resolved and to prevent recurrence. With proper care and treatment, your baby will soon be back to their happy, healthy self. Trust in the guidance of your pediatrician and take comfort in knowing that oral thrush is a treatable condition. Now, is it possible to reduce the occurrence of thrush in babies? Preventing oral thrush involves maintaining good hygiene and taking steps to reduce the risk factors. Sterilizing pacifiers, bottles, and nipples regularly is crucial, as these items can harbor the Candida albicans fungus. If you're breastfeeding, ensure your breasts are clean before each feeding. Wash your hands thoroughly before and after handling your baby or any items that come into contact with their mouth. Boosting your baby's immune system through breastfeeding, providing a balanced diet, and ensuring adequate sleep can also help prevent infections. Additionally, avoid giving your baby sugary drinks or foods, as sugar can promote yeast growth. Breastfeeding and oral thrush. What you need to know. Oral thrush can sometimes affect both the baby and the breastfeeding mother. If you notice symptoms of thrush on your nipples or breasts, such as redness, itching, or pain, consult your doctor for treatment. Thrush can pass back and forth between mother and baby during breastfeeding. Therefore, it's essential to treat both you and your baby simultaneously to prevent reinfection. If you're using breast pumps or other breastfeeding accessories, sterilize them thoroughly after each use to prevent the spread of Candida albicans. When to worry. Seeking immediate medical attention. While oral thrush is usually harmless, there are instances when you should seek immediate medical attention. If your baby develops a fever, refuses to feed, or shows signs of dehydration, contact your pediatrician immediately. Additionally, if the white patches spread to the back of the throat or esophagus, it can cause difficulty swallowing and breathing. In such cases, seek medical help without delay. If your baby has a weakened immune system due to a medical condition or premature birth, it's crucial to be extra vigilant and consult your doctor at the first sign of oral thrush. Additional resources for concerned parents. Navigating parenthood can be overwhelming, especially when your little one is facing health issues. Rest assured, you're not alone. Numerous resources are available to provide guidance and support. Your pediatrician is your primary resource for any concerns related to your baby's health. Don't hesitate to ask questions, seek clarification, or express any anxieties you might have. For more useful dental tips, log on to smile-wide.co.in.